Welcome back to another episode of The Learning Curve. My name is Dr. Irtaza Asar, and this is a podcast where we spotlight the ideas and educators that are reshaping how we practice and teach in medicine. Today, we're going to be tackling a topic that every clinician knows firsthand, but too often ignores: sleep. In medicine, we wear exhaustion like a badge of honor. Sleepless nights, marathon shifts, powering through, they're part of the culture. But what if that culture is quietly harming not only us, but also our patients? Sleep isn't just rest, it's biologic necessity. It governs memory, mood, metabolism, and even survival. When we start to cut corners on sleep, the consequences ripple through every cell in our body and every decision we make at the bedside. Joining me today and returning as the first guest that has come back is the prodigal son, Dr. Nathaniel Ladaga, and he is a core faculty member at Corewell Health, Grand Rapids Hospital, and he has been studying the science of sleep since we last left him. Together, we're going to explore what really happens when we don't sleep, why our sleep system still tolerates dangerous schedules, and what practical steps we can take to reclaim sleep as a cornerstone of both wellness and patient safety. So grab a cup of coffee, and ironically enough, let's dive into it. Dead tired, why sleep matters to us. Nate, how's it going, man? How are you doing today?
It's fantastic. I'm so happy to be back. I've been itching to get back to speak with you. Congratulations on so many successful episodes. This is a great podcast. Phenomenal intro, phenomenal presence. You're doing your thing, and I really like watching every week, kind of seeing how you develop. So thanks again for having me
Oh, man.
back.
Thank you for the kind words, man. I appreciate that. I promise the listeners there is no money going to his bank account. So
True. This
thank
is
you
true.
again for the kind words, man. But honestly, I'm so happy to have you on. This is such a really cool topic, and there's so much to unpack here. And I really want to
Yeah.
dive in this with you because I think this is something that affects a lot of clinicians in a lot of fields, not just emergency medicine, because we've all done residency. We've all had
Yeah.
36
Yeah.
hour call. We've all kind of gone through
Uh,
the ringer. So I'm really excited to dive into this with you.
Let's get after it. I'm excited to talk about it. I just got done talking about this at ASEP. I had a presentation. It's out there recorded somewhere. So if you want to hear the full recording, it's there. Let's chop it up here with the time that we have, though.
Perfect. Let's do it, man. So let's start off with this. We all know what it feels like to be tired, but to understand the cost of sleep loss, we have to step back and take a look at the biology of it all. So
Yeah.
Nate, talk to me about what's happening under the hood when we start to cut corners, and let's start with the science of sleep.
That's a hard place to figure out where to start. But from what I can tell you is we have to just start with like circadian rhythm. We've all heard it. We kind of understand it. It's just what our body is doing, and it tells us like when we should be awake, when we should be asleep. That's the base of it. But what it turns out is that circadian rhythm determines everything that our cells are doing. It determines everything our organs are supposed to be doing throughout the day and the night. And this keeps us tethered to our physiology. It's incredibly important. And if we're disrespecting our circadian rhythm, meaning we're pushing past, working late into the night, working when we should be sleeping, or even just staying up when we should be sleeping, everything will suffer. So every cell, every body system will function worse. And that's what the science has been telling us now for several decades.
Awesome. I think that's a great overview of circadian rhythms and the importance of
Mhm.
that. Can you talk to me about sleep cycle timing and what that is and what that entails as well?
So when you look into the sleep science and when you first learn about sleep in itself, and in medical school, we have like, I don't know, a day, a week, like not much time is spent talking about sleep. But what we will remember and what some have already known is that there are many phases of sleep. And we could break it down into two main phases. There's this NREM or non-rapid eye movement sleep, and there's this REM sleep, rapid eye movement sleep. And there's many phases throughout the NREM, but we'll kind of focus on NREM as like this deep sleep, and then REM is that dreaming sleep. And they're going to go back and forth throughout the night every 90 minutes or so, switching back and forth. What we might not realize that I think is important, the first half of your night is predominantly this NREM sleep. So most of us, normal chronotypes, normal times in which we want to fall asleep, I don't know, 10, 11 p.m. till 3 or so, that's going to be predominantly NREM sleep. And then your body transitions into that rapid eye movement sleep and those final hours of sleep. So that's where you get a ton of your dream sleep and a lot of other benefits that we'll unpack. So it's important to know that they go back and forth throughout the night, but predominantly that first half NREM, second half REM, which then leads to, well, why does that matter? Think about us when we like push ourselves to stay up late. As you go past midnight, 1 a.m., 2 a.m., all right, we're finally going to sleep. Your cycles don't advance with you. They're going to cut off at that 3, 4 a.m. And that's what the science will show us. So you're just cutting out a huge chunk of NREM sleep by pushing past those hours and not sleeping when you should. Conversely, if you're the type, and like me, like waking up 3 a.m., 4 a.m., anxiety thoughts, whatever it might be, and you're just up for so many hours between 3 and 7, you're just cutting out so much of your REM sleep, and it's really hard to gain these things back, especially with the lifestyles that we have created for ourselves, this chronic sleep deprivation. Like we're never, ever catching up from our sleep debt, from residency, from life, from parenthood.
Yep.
And we just have to start getting back to trying to normalize our sleep to the best we can.
Yep. And I think that's actually, you brought up parenthood, and
Yeah.
especially with night shifts and newborn babies,
Yeah.
that just compounds the problem, and it just adds on. And that sleep debt gets heavier and heavier and heavier every single year. And
Yeah.
I think that's actually a really great point. The parenthood is really underrated there. So I'm going to just shout that out again. So, Nate,
Hmm.
you brought up a lot of great points. You broke down circadian rhythms and you broke down sleep architecture with regards to sleep cycles.
Yeah.
So now that we understand that there's this balance that we have to maintain. But the question is still there, right? What happens when we break that balance? What does that mean for us as healthcare physicians, healthcare providers, and what are the consequences of breaking these cycles?
Well, if you want to figure out how this affects us as humans first, and then we talk about how it affects us as clinicians, just look at what happens when you disrupt our sleep for one day and you just strip 1 hour from us all. And in many countries of the world do this, but like for us, at spring forward daylight savings. Like, what are the negative consequences? They've studied this, and you can see just across the board, just negative health outcomes. Heart attacks, AFib, strokes all increase. Just car accidents, people drowsy while they're driving, work injuries. Anybody at work are increased risk for injuries for these fatigue related concerns. Depression, anxiety, mental health crises rise during these days after the spring forward. This all leads to people missing PCP appointments. Then they end up going to the ER. So ER visits rise in these couple of days. And I mean, it costs our economy like $400 billion a year just from injuries, loss of productivity, hospital charges, and just these like days after the spring forward. So you can already see that 1 hour, just 1 hour, it totally disrupts everything that we are as humans. And that's just the most easy examples there are. But as you like go further into discovering the cognitive impacts on sleep, there's a lot to it. When you're sleep deprived, and they've seen this in like fMRI studies, which is pretty fascinating, sleep deprived or sleep loss, less than 8 hours, whatever it is, your prefrontal cortex will reduce. And if anyone knows, if you don't know, that's the part of your brain that's in charge of like critical thinking. That's what makes humans the dominant species on our planet, first and foremost. Like we have critical thinking, we can learn, we can do so many extraordinary things, and that's a key importance. So when you downregulate that, and on the flip side, you're going to upregulate the amygdala, so like the emotional setting of your brain. And so we become less rational, more emotional, and you're trying to like function as a human, as a clinician working in these fields. And so you can see already, you could predict what the danger is going to be. And I'll throw some other examples. So imagine a sleep deprived parent. We go back to parenthood. What happens to their brains when they're up 3 a.m., their baby won't go to sleep, they're crying, sleeping, they can't figure it out. They're less rational, more emotional. Unfortunate things happen in those times. You think of military personnel, police officers on night shifts. How critical is it for them to be very rational focused? Or think about anyone struggling with addiction when they become more emotional, less rational. You can see how this affects us in so many different phases of life. Every human is affected by sleep loss, and this is like the basic reason why we can find out in the science.
Yeah, man, I think that's a fantastic overview.
Hmm.
The consequences of sleep loss, you can break it down into a lot of different facets, but you're going to have physical effects, you're going to have mental health effects, you're going to have cognitive impacts, you're going to have
Yep.
emotional dysregulation. And as physicians, as providers in medicine, this is something that's going to impact us on several different levels. I can recount countless stories on my own practice after having my baby and not getting enough sleep. The fine motor isn't there when you're trying to do
Nope.
procedures. The ability to rationalize and try to switch between type 1, type 2 thinking, it's a lot
Yeah.
slower. Uh, information processing speed is a lot more dulled, especially with 4 or 5 hours of sleep. And you see that with residents as well that aren't getting enough sleep, where on one shift they might be completely on their A game, but then on the next shift, when they're transitioning from, let's say, night shift or a string of night shifts, they're
Hmm.
having those information processing issues. They're more emotionally labile. They're not
Yeah.
thinking as rationally as they normally do. So you can see that impact firsthand. And I think that's probably something you've experienced as an educator as well, right?
Oh, absolutely. And we see this from ourselves. We see this from our students. We see this from the patients that are coming in overnight shifts. Like nobody's in the right headspace being
Yeah,
up at 3 a.m. And it's just such a hard environment to be in, to work through. And it's not changing, right? We can't really change our job. We're there 24/7. Thrive on caffeine, stress, unrelenting human need. And so we have to be available at all times. And so there's just no escaping the demands of our job. But as we're going to get into, we can find ways to help mitigate those problems, mitigate some of these risks. And I'm really excited to talk about that.
perfect. And
Mhm.
that's actually a really good segue. And before we dive into that, I want to ask you about it from a patient safety lens standpoint. It's one thing for us to feel run down, but in medicine, fatigue isn't just personal. It becomes a patient safety issue. And the data shows that sleep directly impacts outcomes at the bedside. Can you talk to me about some of that research?
Yeah, absolutely. And this all comes back to 1984. There was a case that everyone in medicine has heard of, the Libby Zion case. And for anybody who doesn't, 18-year-old female checks into a hospital at night, coming in for fever agitation throughout the night. She's taken care of by an intern, a resident, and like at this time, attending physicians offsite, like call me if something's going on, right? So throughout the night gets worse, gets sedatives, get restraints, still getting worse. Unfortunately, the morning time comes and Libby Zion is pronounced dead. A lot of questions of the case, a lot of concerns, but what it came out in a spotlight, it placed a spotlight on medicine because it was discovered that these residents are working 36-hour straight shifts, sometimes with barely sleep between shifts, upwards of 120 hours per week. And so coming off the heels of this, years of litigation, years of investigation, you name it, in 2003, ACGME started with the duty hour guidelines. And roughly it's like, okay, we're going to max residents in training out at 80 hours a week. You can't work more than 24 hours in a row, right? And that's kind of what we've been used to. As you go through the early 2000s, there's data with interns working in the ICU, and they actually compared them that 80 to 24 schedule versus a like 60-hour and 16-hour shift lengths. So they compare these two groups and they found that the group that's working less, 60 and 16, less medical errors, less diagnostic errors, less patient safety events, less anything that led to like patient centered outcome for harm. And then several years after that, well, it comes out that, hey, no resident should be working over 16-hour shifts. It takes a while. 2011 rolls around, ACGME releases new guidelines, but only for interns because only interns have been studied. And so now interns to this day shouldn't be working more than 16 hours straight, but anybody more than that, like PGY 2, 3, 4, whatever, you can work 24 hours because 1 year of medical training, their argument, is enough to overcome the cognitive impairment of sleep loss. And that's it's simply not true as you go throughout the rest of the research. ACGME knows this. They think there's more studies that need to be done. 2016, 2018, two studies come out with like interns and residents determining, well, is this something that we should keep at 80 and 24? Or you know what? What if we max everybody out 80 hours a week, but that 24 rule, that's flexible. We can work more than that if you need to. Let's just see what the outcomes show. And still to this day, like patient safety outcomes aren't really any different or worse working these longer extended shifts. And as you survey residents in these randomized US based trials, they're all unhappy with working longer hours. And this is not surprising, right? So you have unhappy workers, you have patient safety events are either worse or not inferior to our traditional schedule. And so there's not much of an argument that we should be working greater than 24. We certainly shouldn't be working past 16 from a lot of the other data. And the final one I'd touch on in 2023, the most recent one that I could find is strictly like PGY2s and above. We're watching this group over 8 years, 5,000 residents in the US. So what happens as they work longer? And they discovered over this time that after 48 hours of working per week, compared to less than 40 or so, you start introducing definite risks to patient harm and medical errors. All right, that's 48. At 60 hours, you start factoring significant risk of patient death, 60 hours death. Past 80, which is what we're at now, and nobody works past 80 unless you fudge your numbers a bit. Uh, that's huge risk to resident safety, needle sticks, car accidents, you name it. And of course, the patient risk still increase at that point too. So that's where we are. There's no way around it. The longer you work, the more risk you're placing it yourself in and your patients.
Yeah, absolutely. And I think that's actually a fantastic overview of some of the research behind this as well. For anybody listening, the two famous trials that I can recall off the top of my head are the eye compare trial and the first
Yep.
trial. And like Nate's saying, from a patient outcome standpoint, they didn't notice any significant differences in terms of flexible hours versus the ACGME hours. But what every single resident had reported, or what the majority of the interns had reported, was that they felt that this was negatively impacting their mental health, their well being, and they felt the impact of sleep deprivation as well. So, Nate, now that we've established that sleep deprivation harms both providers and patients, the next question is what can we do about it? Some programs are experimenting with creative scheduling models to protect rest while still trying to meet clinical demands. Can you talk to me about some of the innovative ideas and solutions that are being put out there?
Yeah, I'm glad you say that. And even ASAP, like our governing body group, has reviewed this circadian science, sleep science, and put out some recommendations, which I think are helpful. I believe in 2017 or so, they came out with this document. But the whole thing is to mitigate risk, and night shifts are the worst, right? That's just when our circadian rhythm says you should be sleeping. Your body, your mind, nothing will be working at tip-top function. So to mitigate the risks associated with night shifts, well, we should probably just, if we have to work nights, we should only do single nights at a time. So that is a recommendation out there. Never stringing them in a row. You do a single night, several days off, and then you go back to a day schedule. That works really well. It's hard to do that practically if you don't have like a large group of doctors to kind of fill in those slots, right? Another thing to mitigate some of these risks are like you have to try to get 8 hours of sleep. So if you are working nights, that's really challenging to do at times. Hopefully you're doing at least 4-ish hours before your shift. You get home, you do another 4 hours. So within that 24-hour window, there's like 8 hours of sleep. So that was kind of one of their other recommendations. There are some schedules out there that can kind of silo certain people in a month to work all the nights, and they have some days off in the week. The rest of your colleagues are doing these single night shifts. They call this the Thomas schedule. And as you advance through the year, people then fill in that slot. All right, this is my month of nights. Everybody else is going to work in their single night shifts. And then the rest of the year, I'm just doing those singles. You can see how that could also be a hard sell for some companies, some programs to want to do that as well. Can also touch on the casino scheduling if you'd like me to today. I think that's a
Yeah,
kind of a fascinating one to chat about.
of course.
All right, sounds good. I mean, most of us don't know. Like, I don't know the casino schedule, like just going to a casino every now and then. But if you look at it, they schedule their workers for night shifts in a very interesting way that follows sleep science. And so I'll back up just a little bit. There's this concept called the anchor period. So the anchor period is somewhere between 2 and 6 a.m. If you're sleeping sometime within that window, you anchor yourself to your circadian cycle better. And as you flip back to a day schedule, you're able to recover faster. So less days of just feeling awful. You sleep longer because a lot of times when we come off, we switch where they can't even sleep a few hours in a row. And then you recover faster. You have less cognitive impairment. So that's the anchor period. That's the science. That's found. So casinos will do this thing where, workers in there from like 10 p.m., 4 a.m., 6-hour shifts, and then they leave, they go home and sleep, right? 4 to 6 a.m., they're still within the anchor period. Their colleague has been sleeping most of the beginning of the night, still within that anchor period. They show up to work 4 a.m. to 10 a.m. And so they still are on this cycle. And they found like their workers love that. If they have that consistency, again, if you're recovering faster, you're sleeping more, you're less cognitively impaired, you're just going to be a happier human too, by the way. And so that's why they have continued with their schedule. And can we convince many ER groups to do that? I think that's a challenging thing to do. I know of one group that's done it and reported their results in 2008. This is a group up in Quebec that did this. They surveyed their ED attendings, and the majority of them loved that schedule. They even surveyed the families of these like attendings, and they liked that schedule too. Again, more total sleep, less cognitive impairment, easier to recover. So this is based in circadian science, sleep science, directly being inserted into our field, which I think is a fascinating idea.
I love that, man. I think that's a fantastic overview. The casino sleep science, I think, is
Yeah.
fascinating. And I think that's actually a really cool thing I wasn't aware about. One of the things that, from my standpoint of scheduling wise, that I've always found helpful is to have that phase advancing strategy where you're
Oh
going
yeah,
AM to PM to night shift.
totally.
I I've always found that sometimes when you have schedulers that are outside of the physician group that are scheduling, they don't take those into account, and then
Yeah.
that can make things extremely challenging when you're flipping from nights directly onto a very early morning shift. And the circadian rhythm is now all over the place. You're
Yep.
definitely not getting the full 7 to 8 hours of sleep that you should be getting. The sleep tax is piling on top of that.
Hmm.
So I
Hmm.
think that ends up being very difficult. Fortunately, I think our group and a lot of groups, especially in emergency medicine, understand this. So schedulers are prioritizing at AM to PM to night shift with days off in between to try to mitigate and prevent significant harms to that circadian rhythm. But I think that's actually a great overview.
They talk about with that phase advancing too is you should be on that say AM phase for 2 weeks. You should have at least 3 days off until you phase advance to the afternoons. 2 weeks phase advance, 3 more days. Now you're on like some kind of like overnight type of thing. So this is a long 2 week, 2 week, 2 weeks. I don't see. Hopefully, some groups out there doing that. My group's not quite perfect at that, but that is exactly what circadian science would recommend for us to do.
Absolutely, man. I also think about it from this standpoint, and this is kind of a great segue to the next question that I was going to ask you is really no schedule is perfect. And a lot of us are going to have to grind through night shifts, long shifts,
Yeah.
where our circadian rhythms are going to get disrupted. And that's where I think personal strategies can come in. What can we do individually and as teams to safeguard our sleep and model habits for our trainees?
There's so much that we can do. And what I can tell you is the main things are low risk, widely available, and they're like so inexpensive. Like all the things you want to hear of like an intervention, right? I'm not trying to sell you a pill. Who knows the side effects? Who knows the cost? I'm not trying to sell you weekly injections. It's just like something you can do every day. We all have access to it. I'd like to start, I guess, with that discussion of focusing on like the four pillars of good sleep. So this is recommended by sleep scientists, sleep foundations. You hear it all over the place. And this is the QQRT, if you're familiar with it. QQRT, so Q is quantity. That's what we should be aiming for, number of hours of sleep, 7 to 9. So if you can remember 7 to 9, all right, that's the first Q. Second Q is quality. We should do everything in our power to prevent wake ups throughout the night. And there's a whole list of substances out there that do this, right? Alcohol is the most easy one to talk about. THC disrupts your sleep. Caffeine, of course, for obvious reasons that you can imagine, disrupt your sleep. So the less of that we can do to improve our quality of sleep, we should do that. QQR, regularity. This is the part that's really hard for us as shift workers because regularity means going to bed at the same time, waking up at the same time, no matter what, Monday through Monday, right? We can't do that. That's not in our job. So that's why they recommend, that 2 weeks at a time, slow adjust 2 weeks again to try to establish some regularity. And the final letter is T, timing. You should match your sleep rhythm with your chronotype. So chronotype is really just, hey, I'm a morning lark, you're a night owl, and there's people that are somewhere in between. And this is not like a personality thing. You don't really choose this. Turns out this is like genetically determined. This is in your genes. And so we all have this as humans, as organisms. And the better that we can try to match ourselves with our chronotype, the better our circadian rhythm will be, our function of our body, our function of our brain. So again, quantity, quality, regularity, and timing, those are the four pillars to try to focus on.
I love that, man. This is like such a throwback callback. We went from the
Yeah.
four pillars of learning to now the four pillars of sleep. So
It's
this
always
is
fours. Things come in threes, things come in fours. That's
I
how
love
it
it.
is.
I love
Yeah.
it. Quantity, quality, regularity, and timing. So I think that's definitely going to be one of my big takeaways from this episode, but I love that. Do you have any other tips that you would suggest for somebody that's struggling in this area?
Yeah, I like to talk about the substances that are so common that's out there, if I may. And we talked a little bit. So, caffeine's huge, the most used abused substance in the world by far. And like we kind of glorify like how much caffeine we need to get through shifts, and we have this we have this dependence on caffeine for good reason. Like we have to be awake, we have to be try to be alert, and you name it. But if you can, so you should know that like a half-life of caffeine is roughly 6 hours. So for example, if you took a double shot espresso at 6 p.m. at midnight, there's a single shot still floating around in your body. And you're trying to sleep with that. It's just, or you can tell it's going to be a recipe for not great sleep. So caffeine, if you want to try to reduce the amount, great. If you want to try to just not have any within 8 hours or so, that's kind of what I go by and what I think matches with science. 8 hours before my bedtime, I just cut myself off completely if I'm able to. So that's caffeine. Alcohol, huge, and this is so diabolical in many ways. Not only does it reduce the quality of your sleep, it increases the number of times you just wake up in the middle of the night and you don't remember these wake ups. So it really fractionates your sleep. And then the third part about this is just directly like inhibits REM sleep. So this dream sleep, it's so important for emotional processing, long-term learning, problem solving, creativity. And if you're just regularly doing this or, night caps or something like that, you don't know the hidden dangers that it just destroys your sleep architecture. So if you can reduce things like caffeine to a reasonable degree, try to cut out alcohol like the best you can as well. I think those would be two main things to try to work on as far as substances to avoid.
I love that. And I think that's a fantastic overview because I know I've been guilty of this as well, where you're trying to, get the caffeine on board and you didn't sleep well last night. Now you're trying to overcompensate for that, trying to stay on your A game. It just builds up and that cycle just perpetuates.
Vicious
And
cycle.
oh, 100%. And
Hmm.
I found that at least in the last few years, especially after fatherhood, I think sleep you almost have to take a little bit of a personal accountability to it. Where for me now, it's if I come on shift tired and I express that to my learners, I think to myself, like, okay, what kind of example am I setting for them that I'm
Yeah.
almost normalizing this for them and saying that,
Right.
hey,
Right.
listen,
Right.
I can do this. You should be doing this too. But in reality, I don't think that's the right mindset that I should be perpetuating to them. And I think that's where that personal accountability comes in because I think too often there's almost this perception in medicine that, oh, yeah, sleep is a luxury. But
Yeah.
I
Right.
think that that mindset is so harmful
So harmful.
because
Yeah.
you literally laid it out really well in the last 20 plus minutes that this is something that has poor outcomes from a patient-centered standpoint. It affects us as clinicians from a health standpoint. It affects our ability to take care of patients. So there's so much there that I really think that this is something where the mindset needs to be reframed, where sleep needs to be a safety requirement as opposed to this is just a luxury for me.
That's what it's turned into. We could list a number of reasons why this is just so normal. The way that we live our lives in society, like all the best things in life seem to happen after work, after the kids go to sleep. Let's artificially prolong our day
Yep.
and just experience life, which we should do. Like we should do that. That's part of like the beauty of life. But now we're just normalized, like, we don't need sleep, whatever, whatever. And all these phrases like, I'll sleep when I die. Well, if you do that, you are going to die sooner if you just just don't sleep, right? And so that's like scientifically proven you will die sooner if you're not getting great sleep. Other things that we do is like these nightcaps I told you about, just like, it's a relaxing thing. Yeah, I
Yep.
get that. But if there's hidden dangers, and we stay up late watching like stressful TV shows. Like I stopped watching Squid Game because I was like, this is awful. I'm gonna watch this and I'm gonna go lay my head down and try to sleep. Does not make sense. Like I'm amped. I can't go to sleep. And
Oh
so
my God. I love that.
that's something that we've kind of normalized. But you're totally right. We're just like, oh, if I get some sleep, this is gonna be great. No, it should
Yep.
be a priority.
Yep.
If you want to be a happier person, mental health wise, sleep. If you want to better have regulation of your weight, lose weight, whatever it is, sleep. If you want any health condition under the sun to get better, there's so much good evidence that like sleep is the number one thing that you should
That,
be doing. And so
absolutely.
mental health, cognitive health, physical health, whatever it is, everything gets better.
Yep. Absolutely. If you're trying to control that blood pressure,
Yep.
start with
Hmm.
making sure that you're getting 8 hours of sleep. If you're working on your fitness and you're going to the gym and you want to see gains, then
Yep.
sleep. You want to make sure that you're getting that consistent 8 hours of sleep because that's going to help you from a performance standpoint. So I think that's actually a fantastic overview. I like the Squid Game point too. My wife said the exact same thing. She's like, nope, I'm not going to get good sleep like this. So
Not at
uh,
all. Not
it's
at
a
all.
great point. Yeah.
Yeah.
So now that we've established all this, Nate, and we're kind of running low on time, but I asked you this question before in the previous episode that I had you on, and I want to give you that platform to articulate this. If I'm a first time listener and I
Yeah.
listen to this episode for the first time, what are the three key big takeaways that I can take away from this episode?
I'll try to summarize it, and I'll start with number one. If you just want to think of this globally, when you disrupt your circadian rhythm, bad things happen. That's every cell in your body depends on it, every body system, every organ. You will see negative effects if you're dysregulating your circadian rhythm, not getting that healthy sleep, that QQRT that we had talked about. So that's number one. You should just know that. You can dig into the science if you'd like to. I have some great resources. Number two, as we've discovered since that Libby Zion case, 1980s, decades now of research on patient safety has shown us that there's a disconnect between what science tells us and what we are doing still in medical training and medicine in general, too. We need to start talking about this more. I'm glad that you actually talk with your residents, your students, your trainees about, hey, I'm feeling tired today. I'm not at my best. We should be vulnerable. We should be aware of this. We should say like, yeah, it's not okay, but I have to be here today. I'm going to do better tomorrow, the next day. So in medicine, we have to talk about it. We have to be vulnerable. We have to try to problem solve this solution to this chronic sleep deprivation that we're in. And number three, talked a little bit today about some very easy, widely available, low risk ways to get back to prioritizing sleep. So go through here. You can look on sleep research yourself. Social media is full with really actually great scientists talking about this. Do want to make a plug to the main book that really focused me and started my journey on this research was Why We Sleep by Dr. Matthew Walker. He's all over the place, phenomenal speaker. This is a great book that just outlines all of this science in such a great way, very easy read. And there's so many good tips out there that we can try. So I hope that you take some of this away today. And I hope it does you some good. I hope it does your patients some good, your family some good as well.
Love that. I think those are some fantastic takeaways. And what I'll do is I'll also reference this book in the show notes. And like Nate said, the book is called Why We Sleep by Dr. Matthew Walker. Fantastic resource. So for anybody looking to start their journey on sleep science, that's a resource recommended personally by Nate. So I would
Mhm.
also recommend that as well. Are there any other resources, Nate, that I might not have asked you about that you also want to throw out there for anybody that's looking to dive into sleep science?
That book will kind of branch out to other like resources out there. There's a lot of apps out there. I think that's probably a better way to connect
Yeah,
too for a lot of people. Like I use the Headspace app,
that's space.
and they have like sections on there's their own sleep scientists talking about, well, how do we sleep? And there's some like meditative practices. These are evidence-based things to get back to prioritizing your sleep. So there's some good apps out there. Headspace is one of them. There's one that's called Sleep, I believe. Look out there, look at some of the reviews, try it yourself. I have no financial connections with these. I just think that we have to do something that's different than kind of this culture that we've set out for ourselves.
I love that. And I'll link some of these resources on the show notes as well. So for anybody that's interested in, again, diving into sleep science, this is really a great place to start off with. Nate, I think this was a fantastic episode. I think you gave us a lot of great insight. You helped us identify the problem, why this problem even exists in the first place, and what we can do to be tackling this problem. And I really appreciate all your insight. Is there any place on social media where folks can reach out to you, connect with you to talk about sleep science and even evidence-based learning strategies like the last episode?
Yeah, at Doc Ladaga, DocLadaga. Find me, reach out to me. I'd love to chat. If you want to collaborate on some research that I'm trying to work on myself, let's chat and we can kind of collaborate together, work on this and add to the body literature and try to improve the health of ourselves and our patients.
Love that. Awesome. This was such a fantastic episode and a lot of great insight into sleep science and essentially why we as physicians also struggle with this and what we can do to be better at it. So thank you again for your time. I really appreciate it. And I'll link again all the resources that are out there on the show notes for anybody that's interested in diving into sleep science. So my question to the listeners is this. We talked a lot about sleep science. We talked about some of the things that Nate's doing, some of the things that I've talked to my residents about. What are you guys doing to address sleep science in your curriculums? Is there a particular topic of interest that you guys have found that's resonated with learners really well? What's worked for you in terms of educating residents about sleep science? Let's keep the conversation going. Let's talk and let's keep trying to get better as clinicians and as educators. So please follow us on YouTube, like us on Instagram, and tune in on Apple and Spotify. Thank you guys for listening in. This was a fantastic episode. See you guys soon for the next one.